Hi Brian, thanks for talking with us today. Can you tell us a bit about your role in Rethink Mental Illness?
My name is Brian Dow, and I'm Director of External Affairs for Rethink Mental Illness. We're an organisation that really does two things. Firstly, we're a very large charitable provider of services for people who are severely mentally ill, but we have our roots as a campaigning organisation. We were initially set up by carers of people with schizophrenia, and that's very much where our heritage is. But today we do those two things. We campaign for improvements for people across all ranges of severe mental illness, but we also provide a range of different services for people who are unwell.
Great. And we were talking earlier about, I found really interesting the sector collaboration that you have been working on, particularly the Mental Health Policy Group.
So the Mental Health Policy Group is an alliance of six organisations who've come together really to kind of focus, particularly in the health sphere, on the kinds of improvements that we want to see government and the range of different bodies who are responsible for improving healthcare for people who are mentally ill, make those changes. So those include things like better funding for mental health services, ensuring that children get a good start in life, improving the physical health care of people who have mental illness, because we know that people who are mentally ill are often going to develop chronic physical health problems. Generally improving the lives of people with mental health problems, so ensuring that they've got good access to employment, education, that there isn't stigma surrounding people, and lastly making sure there's better access to mental health services. We know that they're very, very patchy across England, and a lot of people simply don't get access to the kind of services that they need to improve their lives. So that's what the Mental Health Policy Group does. It stays very focused on those issues. It doesn't allow mission creep. It's got a good secretariat and actually is run across the organisations by the people who've got the expertise in policy. So it really has got a very good track record, I think, of making the kind of change across the sector that we need to see to improve the lives of people who are mentally unwell.
That's great. And if you could give a piece of advice on that sort of collaborative working and engaging stakeholders across the sector, what would that be in trying to make that a real sort of tangible outcome-focused collaboration?
I think if I was giving advice on how to run an effective coalition, I think there are three or four things which are necessary. Be absolutely resolute about what your objectives are, and more to the point, what your objectives aren't, because it's pretty easy to get mission creep and then leave yourself too thin. I think the second thing is make sure you have a good secretariat. I would probably suggest revolving that so as that an organisation feels like it's dominating. I think the third thing is accept that the sum is greater than the whole is greater than the sum of the parts, which is to say that as individual organisations, of course you lose something in being part of a coalition, but you're probably better at amplifying your voice. So be prepared to some extent forego some of the limelight, some of the profile, some of that name check that you get as an individual organisation. I think the last thing is probably make sure that you've got some sort of funding, financial operation in place, because it's pretty easy not to let the kind of small stuff get in the way of the big stuff. And if you've got a bit of money behind you, it doesn't have to be very much, but you know who's paying for what. I think that probably guarantees you the best chance. And I suppose there is one other thing, which is make sure you've got clearly defined public lines on stuff, because if you're going to campaign successfully, that's inevitably in the public domain, and often coalitions begin to break apart because when you go out publicly to speak to the media, to communicate your case to the public, you realise actually you haven't agreed on something pretty fundamental. So make sure you've done the hard work first before you go out public.
Fantastic. Thanks so much for your time today, Brian.
My pleasure.